Welcome back, friends. I know it's been a couple weeks, but we're back after
Yay.
a little bit of work-related stuff going on. Welcome to Oh for Dying Out Loud. I am your lovely host, Angie Cat, your magical life maven, and joining me, as always, is my bestie, Laura Shaw.
Yes, you're. So, what did you call me? Divine death doula.
That's
What you
right.
call me. Yeah,
Yes.
love it.
End of life doula,
Yeah.
all things magical to help people transition and help families help their loved ones transition. So
Absolutely.
we were just talking prior to the beginning of this podcast about what we were going to talk about and going through that. And we kind of want to take a little bit of a detour, which is great because that's life. So one of the things that has come up for me, and I was sharing with Laura, is that I had a beautiful, although uncomfortable and painful for me, conversation with a friend. We were talking about the active dying process in some of the loved ones that we have recently lost. And true full disclosure, I have never actually sat with a loved one during their active dying phase, their last breaths, except for my cat, which was, it was smooth, but it was awful for me, obviously. So I recognize that I don't have that level of experience. We've talked a lot about the spiritual aspect of it, that in a perfect world, you have hospice that comes in, makes them comfortable with medications. There might be some agonal breathing. Depending on the chronic condition that they have, there might be some other things that are happening physically. And we've talked before about how, from a spiritual aspect, that little bit of time in that active phase, it may seem like it's a long time to us here on earth. In the spiritual world, it may feel like a blip. And when they get on the other side, they acknowledge that, it really, they don't talk about it. It's like a mosquito bite. So we bring that forward with the idea that that can help bring comfort. And what I discovered with my dear friend was she shared with me that this is one of the reasons why she was not able to come to our death cafes to talk, because her experience of her father's passing was horrible, horrible. First and foremost, hospice was not helpful. As with anything in healthcare these days, short-staffed, couldn't get people to come in. They ran out of pain medication.
Mm.
So they were full-blown witness to their father's suffering, real physical suffering, and it was awful to watch. And so she said, you need to be careful about all this love light. Oh, it's sacred. They're going to pass with, they're not really there in their bodies. They're going to take this beautiful long breath and be gone. She said, because that's not the way it is. And I want to just publicly say that I apologize, because what that is spiritual bypassing. And it's a pet peeve of mine. And I don't want to be the person who's engaging in that. So I apologize to our viewers, our listeners, that if that has come across that way, that is not what we meant. And I will do better. I will do better in being sensitive to that, because not everybody's experience is going to be love, light, and butterflies.
Yes, and I would say to that too that of course I've had the benefit of my experiences typically have been in the. So I've had a couple of personal experiences, but I've also had the experiences as a death doula, and my experiences have never been terrible with hospice. So it is certainly not, it is naive to assume or to speak from this space of, oh yeah, hospice is wonderful all the time, because like anything, that
Right.
isn't always true. And definitely in the last several years, there's definitely been a strain on our healthcare system.
Yeah.
And yeah, so
Yeah.
apologies for me as well, that if your experience with hospice directly with your family was not a beautiful, lovely, I mean, not that death always is anyway. Oftentimes it's very painful to watch someone you love suffer in any way, even if the
Right.
discomfort is minimal. It's still horrible to watch.
Right.
So yeah, so absolutely, I apologize if anyone was left feeling like, no, that's not even true.
Right.
Because yeah, for sure, I
Right.
have only experienced what I have experienced with hospice, which
Right.
I have had great success with hospice.
Right.
Um, both in my personal life and in my professional life. So
Yeah.
yeah, so I hated to hear that somebody's experience was less than
Yeah.
uh
For
because
sure.
yeah, because unfortunately what that does
Hmm.
is puts a stigma on the dying process
Totally.
and hospice. So
Totally.
how likely are people who have that sort of an experience going to be
Right.
um, how likely are they going to be to call in hospice? Or even, and truly, before I had this training, I
Hmm.
did not know all of the things that you absolutely get to demand out of hospice,
Yeah.
or the things you can ask for that you don't know to ask for.
Right.
Yeah.
Right. Exactly. I
Mhm.
think, yeah, I mean, and to your point, I mean, we don't know until we know, until we get there.
Right.
And we would hope that that experience is not the norm.
Right.
Because I mean, certainly with my grandfather, and again, it's one of those things where I was not there. There was a blizzard, there was a snowstorm. I couldn't get there for either his passing or for his funeral. And the story I was told was that, it took a couple of days for hospice to even get in,
Hmm.
number one. And so, and then once they got in there and made him comfortable, that was great. However, with congestive heart failure, it was tough. It was tough
Hmm.
because there's a lot of, without being too graphic, there's a lot of excess fluid that has to be removed because their lungs are literally filling up with fluid,
Yep.
and it can be very rough. And so, and of course, in my mind, I'm thinking, okay, I just had the impression that, well, he must have been sedated enough that he wouldn't have known. But that was a story that maybe I told myself because of what I believe hospice would do,
Yeah.
and maybe that wasn't the experience. So I think it might be good for us to just take a step back and talk a little bit more about the dying process, hospice, how wonderful they can be, and then maybe from your experience, also your training, what can people do both in that stage, navigate through that difficulty of
Hmm.
watching your loved one suffer a little
Right.
bit, or a lot for that matter. And if you do happen to have the unfortunate experience of that, how do we navigate the after the death? Because that certainly leaves a huge imprint,
Hmm. Of
right? So I'm
course.
going to turn it over to you. What thoughts would you share?
So there are things that people can do in the event that someone is dying. And so some people choose not to be medicated. Unfortunately, in this situation, that doesn't seem to be true. It seems like the medication was not available,
Right.
which is a horrible thought. Um, so there are things, so some people want to experience, they want to be as lucid as long as possible. They don't want to be overly medicated. I totally respect that.
Sure.
So, there are things that can be done depending on what the person is, what condition the person is dying from, what their symptoms are. So sometimes it's about changing positions for breathing or for pain management. There are many studies that indicate that people have great success with some of the more well, the non-medical sort of care. So I call it that, but also it's really just the lovely sort of, so like Reiki has been very
Oh, sure.
successful. A lot,
Reiki, I hadn't even thought about
yes,
that.
yep. Some people, like there have been lots of hospices and lots of death doulas that will partner with a Reiki person, a person who can perform Reiki.
And for
Uh,
those who don't know, I'll just
yeah.
interject here. For those who don't know what Reiki is, it's energy work. And
Mhm.
so there's not, depending on the practitioner, there may or may not be laying on of hands, but it doesn't have to be. And in fact, in the medical system, I believe there's also a similar mode of therapy called healing touch, which
Yeah.
is similar to
Mhm.
very much like Reiki. So I'd completely forgotten about that as a
Yeah.
viable option.
It's amazing because these different modalities are getting more and more sort of
Mainstream almost.
research. Yeah, like people are really seeing benefits that maybe they didn't understand. So there can be music therapy.
Sure.
So and some of that a family can do, which is one of the things that doulas, a good doula will really do, is sit down and have a conversation with the person if they're still able to, or with the family, and talk about what music did they love, what really, is it big band, is it classical, is it, you know a marching band, I don't know. But and
Yeah.
really get, like, there is a lot of comfort in that. There's also a lot of work that people do with smells, so
Oh,
aromatherapy.
aromatherapy.
Yep.
Hmm.
So sometimes, especially like for patients who experience a lot of nausea, or dizziness, that is something that they talk a lot about. That limiting the smells and controlling the smells, and
Hmm.
it can even be something like the smell of their pet, or the smell of their spouse, or the smell of, it doesn't have to be lavender or peppermint, although peppermint is amazing for when you're feeling,
Gotcha.
yeah,
Mhm.
just absolutely
Heard of
wonderful.
that.
Yeah, and so, they're kind of similar to what you would experience during a birth, that they will allow you to bring in music, and sometimes they'll allow you to bring in some sort of scent into the room to kind of
Oh,
keep things tranquil. Sometimes
right.
lighting, the right kind
Yeah.
of lighting, definitely can help. And sometimes, and no matter what, like
Right.
all of these things can be really beneficial. And it certainly, they will not take away the pain or the discomfort of knowing that someone you love is in pain. So if you've ever sat through someone else giving birth, or if you have a family member or a child and they were in an accident, and you've ever seen them in a really painful situation, it is the most excruciating and grueling thing, right?
Yeah.
So, and it's true for pets too. If you see a pet, you have a pet that you love, and they're really sick, and you can't make them better. It's a really horrible experience. And I know most people would trade places in a heartbeat if you could take that
Oh,
pain away.
for sure, because we
Right.
feel helpless. We just
Hmm.
feel helpless that we can't take it away. And that is hard. It is
Yes.
hard to sit with
Yeah.
that.
It's super hard. So one of the beautiful things about a doula is that a doula can help you navigate, putting pressure on doctors and hospice to get what you need.
Mhm.
But if it is truly the case that the medication is not available, which I know, especially during the last several years, COVID, and just other things, a lot of medication has become much, like a friend of mine who is a diabetic just explained to me that one of her medications is getting really challenging to get because they also use it as a weight loss drug. And so she needs this medication to keep herself alive. And
Right.
other people are taking it to lose weight, which I'm not saying that it's not wonderful. It's just literally, she finds herself in this really precarious position. So,
That's interesting.
um, yeah, so meditation is really wonderful. Uh,
For both parties. Like,
yes,
I mean, as a
absolutely.
mindfulness instructor myself, a
Mhm.
meditation instructor, I mean, as another resource, and we put that in the comments below this podcast, but John Kabat-Zinn's work, mindfulness-based stress reduction. There's a whole workbook out there, and they have mindfulness strategies or mindfulness meditation strictly for chronic pain. And they've actually used it in Johns Hopkins University as a treatment, an adjunct to treatment, because they've seen that when people practice mindfulness meditations on a regular basis, that their pain index comes down. Does it go away completely? Not necessarily, but even if that can be used, you know, in adjunct with everything else, you know, I'm a big believer of throw everything at it, right? That's how I approach my entire life. Is something isn't working, I'm going to throw everything at it until and find the right mix, you know. But certainly mindfulness, I know, has been shown to assist with both the person who's in pain, but also the person who is watching, because you're dealing with your own pain at that point, right? It's an emotional pain.
Yes.
So
well, and yeah, so one of the great things that I would always recommend people do is, in any sort of situation where you're experiencing these sorts of situations, especially with chronic pain or chronic illness or a debilitating or life-ending illness, is do a Google. Don't WebMD it, because that's the worst thing you can possibly do, because we're all dying of a brain tumor of some kind, I'm sure. I got a hangnail, I tore it. What do I do? I'm dying. So
don't self-diagnose people.
Right. Sorry, don't do that. But go to the Cancer Centers of America, look and see, or the American Cancer Society, and you would be surprised. I think most people would be surprised by the number of organizations that absolutely have a nutritionist on hand. They absolutely have a Reiki, someone who can perform Reiki, or someone who, like, I have been known to have an acupuncturist on call. So it's not because it's something that a person has ever experienced before in their life, but if that is what it's going to take to make a situation better in this space and time, it's absolutely right. I mean, you're just desperate at that point, and so make as many decisions and try to make it as comfortable as you can be. Hot, warm blankets, cool blankets,
temperature,
like whatever,
weight,
so,
etc.
Yes, for sure. So there are things that a person can do, and in that moment, it's not necessarily the thing that you think of. So
for sure. And I think too, this is also speaking to have this as part of your conversation well before your loved one gets to hospice. Like, what are you comfortable with us trying? Are you okay with us trying some alternative therapies to manage your pain, or not, you know, so that you are armed with some information about your loved one's wishes and what you're able to do. And again, can't advocate enough for having an end-of-life doula there, because they can help you navigate that, but also giving the caregiver a break. When it becomes too much to handle, you have to fill up your own emotional bucket. I would imagine, from what I've learned from you, that the end-of-life doula can not only, you know, take the family aside and go, I know this is hard, validate your feelings, that this is difficult, that it's hard to watch, that they're going to be feeling all these different emotions, and give them a break. I will sit with your loved one while you go and take a break, because it's just hard. It's just hard to be with that for any length of time and not be impacted by it.
Right. Well, and something, you know, I just talked to my neighbor today, who borrowed a shovel a few weeks ago because she lost her dog. And she is a single person, and her dog died very unexpectedly, and she wanted to dig a hole in the backyard and bury her dog. And which I didn't know people still did, but it was lovely. And I'm just like, so she brought the shovel back. And she said to me, I said, did you get it done? Did it go okay? And she said, no, I don't know what I was thinking. I dug this giant hole in my backyard and realized the dog's too big for me to pick up. He was a very large dog. And I'm like, oh my gosh, why didn't you come get me? Like I would have. And she's like, no, I don't know. I don't even know what I was doing it. Like she was so
Yeah.
in the emotion of it that I absolutely, she couldn't have made, it all worked out. Spoiler alert, everything worked out fine. She called animal control. They came and got her,
Yeah.
came and got her puppy. They cremated and she's picking him up tomorrow.
Right.
So everything worked out okay. However,
Right.
she just filled in that hole today because she didn't have the heart to do it for a couple weeks.
Yeah.
And in the meantime, she's like, it was like autopilot. Like
Totally.
sometimes having someone who, which hospice can do some of, although as we've learned, and during COVID especially, hospice was just kind of in a different place. And one of the beautiful things about end-of-life doulas, especially during the time of COVID, is they definitely, there was this big movement to allow for them to be present online, virtually. So they can come in and talk through what's happening, even if they can't be in the space with you for
Right.
whatever reason.
Right.
And so in a space, you know, if it is calling a doctor, if it's calling a friend, if it's calling having a doula, any spiritual practitioner, the church, anything that I mean, some people it's about praying. Like, you know, there's great research into um prayer as a form of medication and the miracles that that can work for people. And some people would absolutely not want that to happen, and
Okay.
some people would absolutely be delighted and absolutely it would work for them. So
Right. Right.
I think that you're right, having those conversations ahead of time, and also being flexible with I mean, I don't think that anyone could prepare for hospice to not have enough medication,
Yeah.
because that seems like such a failure,
Right.
that I cannot even imagine being in that situation for that family,
Right.
as a loved one, watching your loved one
Right.
in such an uncomfortable space. So, and
And to be
painful.
fair, I don't know. I know that they ran out of medication for a time. I don't know if
Yes,
they
sure.
completely ran out of medication for the remainder of his
Mhm.
time on this plane. But just to qualify that,
Right, right.
that there, you know, hospice may have come through after, you know, a lot of chain, you know, cage rattling. But the
Yeah,
fact of the matter is, they knew that it was going to run out after doing the calculation. Here's how many pills we have.
right.
And there was delay, obviously, to the point where that person was in a great amount of pain.
Right. Well, and just the discomfort, I cannot discount the discomfort of the family.
Oh,
That because, you know, whether we like it or not, even when we know someone is going to die and that this is what's going to happen, we're not prepared to just
yeah,
have it be over and not to watch the suffering. Like, no, it would take a very sick individual to be okay with suffering. Like, I just don't think that
no,
that's something that we
no,
are
yeah.
interested in this life.
Mhm.
Um, so yeah, that I cannot say enough how what an unfortunate set of circumstances anytime, and there will always be discomfort,
Right,
mostly at the end of people's lives. Like we don't get out of here without a bit of a mess.
right, right.
Um,
And
but
that doesn't always happen. This was the other thing too I learned, was that from another person, was that it's not just about being in hospice.
mm,
This situation can absolutely happen in a hospital setting, you know.
right,
And the other gal recounted about how, you know, their loved one was literally screaming in pain and they were plugging their ears just to be able to sit with them. And again, rare scenario, but we don't want to spiritually bypass that or bypass that at all. That
right.
that, that you know, this can be tough. And so having those conversations, talking through all the different options and having some additional support when you're like, I have got to tap out because this is hurting my heart so much to
Right.
watch.
Mhm.
You know, it's totally okay that you're feeling that.
Well, and I think that having the conversation, it's kind of like when you do your durable power of attorney and you start talking about all the different scenarios that can happen. I think it is a completely appropriate conversation to have to say, if you cannot stay with me in this space because of your own discomfort, because of what's happening to me or what's happening around me or you, or like,
Mhm.
I think that that's a fair conversation to have. Would mom want you in the room
Mhm.
if she was experiencing something? Like, I wouldn't want my kids in the room with me if my discomfort was such that it would cause me to wail and just be like, I don't want that to be their image of me.
Right.
And I would want them to have not only my permission, but which of course you can't know ahead of time,
Right. Right.
but I would want them to know that they have my permission, that if that is the case,
Yeah.
they can leave.
Right. Well, and let's think about this too. I mean, you can talk about it ahead of time and go,
Mhm.
absolutely, go and take care of yourselves. And then where we're in it,
Yeah.
there absolutely may be, oh my God, please don't leave me. So it's also about, I think, and this is just goes to communication in my mind, is like how to handle that communication. Like, I know that you are feeling a great deal of pain right now, and I am so sorry. We're going to do everything we can to make you comfortable, and we're here for you.
Mhm.
But right now, I've been here for a while. This is hurting my heart. I need to go and take a quick little break in order to recenter myself so that I can be with you. You
Right.
know, so it's how do we navigate those conversations as opposed to, I gotta go, because we're
Right. I'm out.
humans.
I'm shutting down. Literally shutting down.
Right. It's
Mhm.
how do we be comfortable enough and know that this is a messy human
Right.
process. It's messy. And all of the feelings and all of the things are valid.
Right.
And so regardless, we're just, trying to give light to all the possibilities and empower people with some more information so that you can have that conversation. You can line up some other individuals,
Yeah.
a Reiki practitioner, a death doula, or whoever that can help you navigate through those situations if you need them. We
Mhm.
hope you don't,
I hope you
but
do.
if you do, know, put as many tools in that toolbox as you have.
Right. And another beautiful space that hospice, or if your experience with hospice has not been good, death doula, or the church or faith community, whatever, in Native culture, maybe a medicine person could come and just sit with the dying person. You see that a lot in smaller communities, especially, but like a member of a congregation or a member of a tribe will come and sit. So you could have a representative, even if it can't be you. Like,
Right,
just literally, it maybe it can't be you for
right.
your own mental health. And also, I mean, I just have to believe that most of the time,
Mhm.
a person would not, like, I just literally would not want my children to watch me
Mm,
in pain if it was hurting them. Like, I definitely have a kid who I think could be there, and then I have kids who I think could not be there
right,
because
right,
some of
right,
them could separate that and be like, yep, I got this, I'm
right,
here, I can, this will be fine, I understand this is the end and it's uncomfortable, and
right,
it's not good. And then some kids would be like, no, I'm tapping out, I can't do this. And
right.
I absolutely, this is why not everyone can be a death doula.
That's
Uh,
right.
right.
Totally.
This is not an easy space, and not everybody can be comfortable in this space. And
Absolutely.
there is no shame in that. And
None.
we should not even, like, I I remember when my youngest was in the hospital when she was little, and
Hmm.
I stayed there every day with her. I've always stayed at the hospital with her. She's 23 now. And she would be in the hospital for a few days and I would just stay with her. I'd stay overnight, I'd sleep in the chair, I'd work from the chair, whatever. And I couldn't ever handle the fact that there was a little child next door crying all day for their mom or their dad. And it just broke my heart. And I remember thinking, oh my gosh, why isn't there a parent here? And I couldn't understand it. And then I thought, how privileged am I that I have I have been afforded the luxury that I have a family who can take care of my oldest
Right.
and a job that will still pay me to be in this space, because
Right.
not everybody but it
That's
really,
right.
it was
Right.
eye-opening for me that
Yeah, it is
that
true.
my initial response was this one way. And so I think the
Yeah.
same is true in the death of people.
Mhm.
We all think that we would want our loved ones sitting next to us, and maybe most of us would. And also, I think most of us would also accept that some loved ones are just not cut out for this space. And
Right.
it's okay if they can't do it. Somebody
Right.
else can step in. It'll be okay.
Absolutely. And I think that's really important, the no shame piece of it,
Hmm.
because if you're one of those people, I mean, I have no idea why, because I've never actually sat with someone who was in the active dying phase. I have no clue. I like to think of myself as being, able to handle it, but I don't know. I don't really know how that's going to shake out, and will my job afford me the opportunity to be there,
Hmm.
And so we have to, and this is why, depending on your relationship with this person, you know just give yourself some
Hmm.
grace, because if you're not able to be there, let's say you have a close relationship with this loved one and you just can't be in the space, it's too hard for you, just the fact that you loved them and showed your love throughout the rest of their life, that is enough. They're going to hold on to that,
Hmm.
and you're going to, at some point, you'll have to, or not have to, at some point, we hope that you'll come to that place where you will not beat yourself up, that you will give yourself grace and go, I was there for them for the most part, and they absolutely knew that I loved them, so
Hmm.
that in those last moments when it was hard for me, I could still send my love. Love is an energy, and they can feel that. And
Yeah.
so it is so vitally important. And that's part of the sacredness of it, is where can I extend grace to
Hmm.
them, to myself, to other family members
Hmm.
that can or can't be there, because it's complicated. It's
Right.
complex.
Well, and I often have to remind myself in situations that, so in a dying situation, I think of your grandfather. You spoke to him, he knew you loved him, and he loved you back.
Right,
And you could not be there. You just couldn't. I don't think anyone
right,
who, I mean, literally it was a blizzard. He lived far away from
right.
you, and there was just physically no way for you to get there. And I cannot think of anyone in the world who would say, oh, she should have, like, I don't know, gotten a dog sled team together and somehow made it into this giant blizzard. It's fine.
Yeah.
Um,
Well, if
and
somebody leveled some Catholic guilt on me, I may well have gotten a dog team. I don't know.
right, right. And so I always think of that, like, how is that different than someone who emotionally cannot be in that? Like, they
Right.
just, like, I wouldn't make my 7-year-old go into the room and hold the hand of someone in that position. So I don't expect my 27-year-old to do it. Like,
Right.
sometimes a person is just not. I definitely have a kid who could pick up vomit, and I have a kid who can't. It's just one of those things. It's not a judgment about either one of them. It's
Right.
just it's just who they are.
But yeah, you're absolutely right. And I think the more that we can really remind ourselves of that, because
Mhm.
I think that's one of our, I don't want to say failings, but that's one of the flaws of being human, is that we do have this expectation a
Right.
lot of times that these humans that are my family should be emotionally strong enough and mature enough and capable enough to handle anything that's thrown at them.
Right.
Now, I don't know about you, but I can't do that for my own self sometimes,
Right.
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 And this is why there are therapists in the
Mhm.
world, so, but that's what I'm learning is that, it's grace. We do the best we can in the moment with what we have.
Yeah.
And then we learn and then we try again and we do better. And that's all that we can really hope for,
Mhm.
and expect from people. So I'm glad that we're having this conversation because it is not necessarily easy. And we didn't mean to paint that it was easy from a
Right.
spiritual
Not at all.
standpoint. I mean, when we get on the other side, I think many of us will go, oh yeah, okay, this really is how it is, and I'm free of it, and it's lovely. But in this human experience, that's not what we will potentially experience or know, and that's okay. It's
Right.
okay.
Right. For sure.
Yeah.
Um, it's definitely for anyone who's had a bad hospice experience. I'd like to say, first of all, I'm so sorry that that is something you've experienced. Uh, I know that hospice is often people hold off until the absolute last minute for hospice, oftentimes because they just don't know
Right.
what they could have with,
Right.
I've seen people have these amazing experiences where hospice came in very early and really did some great work. um and for people who would never trust hospice again, I understand. Like, if I had that experience, I don't know that I would either.
Totally.
And definitely for that, I would absolutely recommend that you start reaching out to, not now unless you need us, but although you can reach out
Right.
to Dr. Liz at any time, and start making plans so that your experiences in the future
Right.
are hopefully better than
Right.
the experience that you had in the past, because that I do, even a bad experience can still
Mhm.
be sacred. It just is.
Yeah.
Someone ending the ending of someone's life is just sacred. No
Yeah.
matter good, bad, or otherwise. I just believe that.
Right.
Um,
Right.
and I hope that that doesn't taint because we're all going to die, like every one of
Right.
us. And
Right.
so I hope that that doesn't taint any future end of life experiences for them, for their family, because what a horrible, horrible um, scar that could leave upon a person, um, for sure.
But I think too, though, it's similar to forgiveness and grief, is that everybody's going to come to those realizations perhaps on their own timeline.
Mhm.
But this is also like, depending on the experience that you had, I do feel like it is important to talk to a grief counselor or
Mhm.
someone who can help you navigate that, because there's the dying process that is, as you may have experienced, maybe it was effortless and peaceful and sacred. But for those who don't have that experience, now you've got something lumped on top of it. I've lost my loved one,
Mhm.
and it was a really challenging, traumatic exit. And how do you navigate through grief, let alone if you had to witness that? Do you know what I
Right.
mean? Like,
Yeah.
grief is hard enough as it
Right.
is.
Well, and what a trauma that will leave for you, going into your own end of life, into someone else's end of life,
Right.
family.
Right,
Yeah.
because it colors everything that you see now,
Mhm.
and rightfully so. But how do you, so that I think that is where it's really vitally important to not keep that inside, to have a trusted person, a grief counselor, death doula, or combination, to talk through that,
Right.
because that does leave an imprint. And the next time may be completely different, but
Mhm.
that's like a heavy wet blanket that's now been put over the whole thing, and that will
Right.
color the way that you see the process going forward. So,
Yeah.
and it's just for your own healing, because now you've picked up on that emotional you've made that into an emotional trauma that now you're carrying.
Right. And in our conversations with death events, I hope, and definitely we will reiterate this in the future, I hope that people understand that space, something that I love about that space when we go into it, is the number of people who can come and share. They can share their grief, they can share their story, they can share their experience. And it is a support. It's this
Yes.
beautiful supportive community, I think, that we've been able to witness, both in people that have lost people who have been part of a dying process, people who they themselves are on this journey, end of life. So I think it's this really interesting space that brings along with it this really safe place for people to share those sorts of that feeling of no, this is because you're right, that anxiety, if you let it build, it will continue to build.
Yeah.
And so
As with
definitely,
any anxiety, for
right,
sure.
of course. So
Yeah.
I hope for them that anyone who has that sort of that you can uncouple
Yeah.
that experience, not to forget about it or not because it doesn't exist,
Right.
but just so that when you're in that process at a future point with someone else or for yourself, that the anxiety doesn't turn it
Right.
into something that
Right.
it doesn't have to be
Right.
again. So
Right.
hope.
Totally. Well, and I can speak to that directly. I mean, I have family members who watched their family members suffer, and that absolutely has become their anxiety about the dying process for them.
Right.
And that is their biggest fear. I don't want to go the way that they did. And even and all things considered, it's suffering's on a spectrum, right? So it's all, kind of up for interpretation, both by the person who's dying and the person who witnesses it.
Mhm.
But again, if you know that has colored your perception and now you've got all this anxiety, I think it's important to work through that as much as you can, to help yourself in your own healing, you
Mhm.
know. And it's interesting because as we wrap up tonight's session, I do want to mention that our next podcast, we're going to have a special guest.
Yay.
Yes, I'm super excited. Sandy Lafferty. She's local and she's with To the Rescue.
Mhm.
She is a home health administrator. And so she's going to talk to us a little bit about her own experiences from that realm in terms of death and dying. But also, she writes beautiful poetry,
Mhm.
particularly that has helped her with her own grief process. And so, we're going to talk a little bit about how some of those things, some of the arts can help us, not just with death and dying and grief, but any of the difficult emotions that we might feel, that this could be a beautiful adjunct for us
Mhm.
to navigate the death dying process, the grief process. And so I'm excited to have her
Me
next
too.
time as well. So
Yeah.
yeah,
Yeah.
that's very cool. So any last thoughts about this idea of the death and dying process and the fact that it may not be as rosy as we want? It's not, like my friend said, it's not like in the movies. It's not
It's
always
right.
like in the
Right.
movies.
Yeah.
Right.
So definitely I would tell people that much like with life, it is messy. It is messy. It can be varying degrees of messy. So the best thing I can say to people experiencing it is to make sure to carve out the space for your loved one that will keep them as comfortable as you're able to, and space for yourself, and know when you have to tap out, because it is too much,
Yes.
and have a plan for that, make a plan.
Yes. Yeah. Talk about that plan now. What kinds of things is your loved one open to trying in terms of being able to manage whatever pain level, discomfort that they're feeling, but also how are you, this is what they commonly call caregiver burnout. It's a real thing. And so
Yeah.
talk to your other family members who are joined together in this caregiving and having a plan of, when it gets too much for me, can I call on you? It's not, that will be much more helpful to you, rather than having you all there at the same time and all of you burned out, So it's a part of the dying process that I don't think, we talk about the paperwork, we talk about the sacred transition for the person who's dying, but we don't often talk about the process for the caregivers and the loved ones. And there is an actual process for them outside of the paperwork in terms of taking care of themselves and being able to not neglect your self-care, so that you can be witness to whatever sacredness you can glean from it, as opposed to completely wiped out, completely burnt out, and it was an awful experience, right? So, yeah, good stuff. Oh, this is a great conversation. And I'm so grateful to my friend for sharing that, because again, she was reluctant to share it with me. And I said, I absolutely needed to hear that, because how many of us have ever done that? In our spiritual journey, our spiritual path, how often have we inadvertently done that spiritual bypassing with anything? Like, like what's the classic one? Oh, God will provide. Will provide. It's like, well, that doesn't help me when I'm feeling like crap, So it was really a perfect example of really being present, hearing when that person, what we said or what we did was not what they needed, and being able to course correct that, So, so it was a beautiful opportunity for us to dive a little deeper into this topic. So I thank you for sharing a little bit more from your perspective. So beautiful. Wonderful. Well, we're going to wrap it up, and we're so grateful that you guys are following us and engaging in this conversation with us. So this podcast will be up shortly. Click subscribe so that you can follow. We try to put out new podcast episodes every other week or thereabouts, depending on our schedules. And we'd love to continue the conversation with you. So join us next time. Sandy Lafferty is going to be with us, and we're going to talk about poetry and art as a means of healing through grief, and her experience as a home health administrator. So
love that.
Thank you all. Have a great rest of your week. And for dying out loud, we hope you live a little this week.
Absolutely.
All right. Thank you all.